Well, the garden you see here, you can say really came about because of thyroid problems. I'd lost my marriage early part of this century when I'd been diagnosed with an overactive thyroid that then emanated into thyroid eye disease. Some years later, I got to know Liz, my fiancée, and of course when I saw her garden here, it was a bit like an artist with a blank canvas. There was just a big expanse of lawn and just 1 or 2 little flower beds. And of course I said, well, we can make something of this. It is a very calming influence, and I find during my troubles when I was very, very ill, just to go out and just be with the plants, helped me a lot. When I was potting or trying to do cuttings, anything like that, I was trembling. I thought, well, what's this? I thought, it's weird. I thought, is it Parkinson's or something like this? No. It carried on, and then I started to lose some of my appetite, and for me to lose my appetite was unknown. So that's the point when I went to the doctor. And they said, oh, you're depressed. And prescribed some antidepressants. I thought, I don't want these, I'm not depressed. He said, right, he said, come down to the surgery straight away. He said, I've got some tablets for you. You've got an overactive thyroid. This was kind of middle of April. He said, you should be ready by June, back to a healthier state, euthyroid state. Because I said, well, I've got Gardeners World Live down at the NEC. Oh, he said, you'd be okay for them. So on the second day of the show at the Gardeners World Live in Birmingham, I noticed that this right eye was actually dripping tears all the time. They were running down my cheek, and the eye felt as though it was trying to push out of the orbit as well. And the lady on the stand with me, she said, there's something wrong with your eye. She said, it doesn't look right. I said, well, it certainly doesn't feel right. And I was in the eye clinic at Burnley General Hospital and saw an eye specialist there. So he said, well, I'd like you to be seen by one of the consultants at Blackburn. And when I did see this lady, middle of August, she said, well, I've got good news and bad news. She said, the good news is you won't have to come and see me again because I'm going on maternity leave in 3 days' time. But the bad news is you got thyroid eye disease and you could go blind. And of course, I've just set up the stand at Southport Show. And one of our top shows of the year, a lovely colourful event. So I went back there rather depressed next day. But of course I was also being realistic because I thought, well, is this the last time I'm going to be able to see all these lovely displays of plants? Arrangements have been made for me to go to the Christie Hospital the following Monday to have radiotherapy on the orbits. Because by then my eyes were completely locked. I couldn't move them up or down or left or right. Then I carried on with very high steroids. I was on massive amounts of prednisolone, which was causing me to swell up. I was putting on a very large weight gain. I got to 19.5 stone from a normal weight of 15.5, 16 stone. And couldn't get shoes on, so I had to walk around in sandals in the middle of winter, which was pretty uncomfortable. So I started to get chilblains, and then of course ended up with thrush and all horrible things, mouth ulcers. And that's when they referred me to Newcastle, where I was found to have a very rare form of this disease that was threatening to crease the retina at the back of the eye. And that's where in the autumn of 2002 they performed a decompression surgery on me and saved my sight. And I take my glasses off to show you where they cut. Normally they cut along the smile lines, which they did with me, and as I put my finger there I can feel a tingling of where the incision was made, and also here. And then the face mask is taken down and up to free off space around the eyes so the surgeon can get access to all this material. In the case of my surgery, they also took some bone away as well to make the actual orbit slightly larger. When you've got a thyroid problem, you feel you're just out there on your own. Although there's about 25,000 people a year diagnosed with this in Great Britain, it still is a relatively rare disease. But there was a school of thought speaking to a chap at the Thyroid Eye Disease Charitable Trust that the shock might have triggered off my thyroid problem. And in the summer of 2000, we had 2.5 inches of rain in just over an hour. Terrific hail, massive. And my nursery was virtually kind of, well, half demolished. But when you can see your business being destroyed in a massive storm before your very eyes, it just obviously must hit you deep down and could quite possibly trigger something off. You can have a thyroid problem, overactive thyroid, without any problem at all with the eyes. A lot of people have an overactive thyroid and it's treated and it's fine. Or they may have partial removal of the thyroid that just calms it down, so you've just less production there in the thyroid, still in the patient's body. I've been working with the British Thyroid Foundation now for a number of years, since '03. And one of my other voluntary jobs I do for the BTF is to help on their telephone helpline for patients with this disease, as well as the overactive thyroid. People who shut themselves away, I think, are losing out on a lot. It's nice to be able to help other people. So again, something good has come out of something bad. This is the way I look at life.